Shobha. I can't see Dr. Akshay Banker here.
He has to put on his camera.
Okay.
Okay. Am I heard?
Yes, fine.
Yes.
Okay.
Yes, ma'am, I'm here.
So good evening, everybody. This is NJH talking to you I'm from Mumbai. We have this great panel from all across. So today is this very, very interesting topic. In the sense it touches all of us. There's no homeopath or layperson who today's topic will not touch. So that means it is such a live, vibrant topic that all of us should participate. And we have in our panel very, very experienced homeopaths, all over 30 years of experience. So yes, Dr. Ketan Shah, where are you from?
I am from Ahmedabad, Gujarat.
So he has how many years of practice?
30 years plus.
30 years of practice. So if you combine this total, is going to be humongous, okay? And we have Dr. Shobha next to him. Dr. Shobha, where are you from?
Yeah, I'm from Mumbai, ma'am, and I'm practicing since last 33 years.
See, there you go. Then you have next, because I won't tell you how much I've been practicing, so you all know. Okay, Dr. Jagos.
Yeah, ma'am, I'm from Mumbai. I'm practicing the last 34 years.
So everybody is over 30 years, okay?
Yes.
And we have Dr. Akshay Banker. That is from. We can't hear you, Akshay. You're mute. Please put on the mic.
Unmute yourself, Akshay.
I think the admin must have. Wait, sir, I will try.
You are mute.
Yeah,
Yes,
sir.
ma'am.
Yes, sir. Yes, sir.
I was not able
Okay.
to unmute myself. Okay, so I am from Toronto, Canada, and I have been in practice for last 36 years.
Okay. So can you total anybody good in maths can do this computing of the table to all the 5 people? Yes. So we have more than 170 years.
Yes. Yes,
You can
with
get
you included as the boss.
Yes. So you can get any question you have answered, okay? And you will say,
Yes.
but why do we need to have questions? Because we all the time face these problems day in and day out. However long you're practicing, your patient will come back to you with the same question, You have to give answers which are convincing, okay? Not brush them off because they have to be convinced. So what are the problems that homeopathy faces? Why does homeopathy face so many problems? After all, it's been around for 200 years and by now everybody should be used to it. No, but we have every day a question, every day, every few months, we have an attack on homeopathy. We have somebody or the other saying that, something good about homeopathy, something bad about homeopathy. So why does this constantly happen? And what are we as lay people, as homeopaths supposed to deal with it? And that's what we are going to discuss today. If anybody in the audience too has questions, they put it on the chat and we will see that we can kind of attend to it. Okay. So good evening, everybody again. Welcome to NJH Roundtable, which is like a very happening thing which happens every month on Saturday and
Fourth Saturday.
on the 4th Saturday, and we all are very happy to be here and talking to all of you. Okay, so we'll talk today about common. First, we'll begin with the common myths which are happening. Okay, the first question which anybody asks you: does homeopathy, is it slow? Does it really work? Does it act in acute cases, chronic cases. We come to it only for, when you're well, so and so forth. So first I'm going to ask, in the panel, we have one lady member, so she's going to talk to you first. Dr. Shobha, would you like to answer some of these questions which come to us?
One lady
Yes.
goes to another lady.
Thank you, Ketan.
Yes. Yeah, ma'am. Yes, like, yeah, being in the practice, most of the time, the patients, who are taking the homeopathy for the first time, who have not taken earlier, or who have heard it from somebody who they do wish to take homeopathy, but they have heard from the others, so they do come and ask that, will I get the result immediately, or it is a slow, and how much time it will take. So that all again depends on to the type of the conditions. Like, if it is the acute, then it never takes the longer time. The time it takes any disease, if it is in the acute stage, as much as it is going to take with any other pathy.
Or even less.
Yeah, or even less. Yes, definitely. Whereas if it is in case of the chronic diseases, like what happens is many times patients get tired, they are suffering from some chronic illnesses for years together. And after suffering it for another 10, 15, 20 years, and then they come to homeopathy to take the help, then those are the conditions where to help them, to in that disease from a very deeper root, to remove that, to a great extent, that is where it takes time. Otherwise, like in the acute conditions, it doesn't take time. In fact, it acts very faster than the allopathy many a times. And
what you're trying to say, Shobha, is that it is a myth that homeopathy is slow. It is
Yes,
not
definitely.
really true. And we
Yeah.
have seen it in patient after patient. And anybody who comes to us with an acute fever, an acute diarrhea, we give a medicine and we sometimes see an action, you're saying within 15 minutes or within instants,
And nowadays, so recently, what I'm practicing is that, when patient is sitting in front of me, there and there itself, we give them one dose, and not only me, many homeopaths from our team also, from others also, are practicing that we give the one dose in the patient's mouth there itself when they are sitting just opposite to us. And they would in no minutes, meaning in 2 to 3 minutes or even 1 minute, as soon as the medicine is reaching their tongue, they would immediately say that they start experiencing the difference. So that how that quick is
so
the
that kind of experience which happens, they may say that is that is called faith, or that is called suggestion. But if you have to say that homeopathy really works, what is the kind of thing that people will accept?
No, ma'am, here I would like to add one more thing. Why am I saying this is because it is very scientific. It is not just the experience of the patient, because in allopathy, when they take a tablet, it has to reach to the stomach to dissolve. Once it reaches the stomach, it dissolves. Whereas in homeopathy, the action of the homeopathic medicine starts, there is a bunch of nerve roots just below the tongue. And as soon as the homeopathic globules are taken in the mouth, the absorption starts from the mouth, from this nerve roots itself. So that is how it is so quick, that the medicine starts getting absorbed from here, and the action will start immediately.
Yes, very good. So that means that if a patient has some problem, this, because I am keeping on harping on this because these are the questions which come, right? So if a patient has a problem, or if you have a small child, you have a baby come to you for diarrhea, for example, 3 months, 6 months, 9 months old, and the mother says 24 diarrhea in the last 24 hours, it's still not controlled. You say you will keep the patient here for half an hour, 1 hour, look at it, give some medicine, and see if the diarrhea stops. So there was no kind of slow action. You have proved both slow action and that there is no faith involved. The baby doesn't know, right?
Exactly.
So you have now answered the question of slow, that it is very this, and it's immediately effective, and that it is very, very scientific. Okay. So how else can we, what are the other questions that we come up with all the time? All the time.
One of them is usually, can a diabetic patient take homeopathic medicines?
Yeah.
because many people come to us have diabetes somewhere or the other, and they are worried whether they can take homeopathic medicine.
So
So
what's your answer?
the only answer is that yes, diabetic patients can take homeopathic medicines, because when we give a 1 week supply of medicine, if you powder that those globules, it will come to about 1 tablespoon of sugar. Now, this 1 tablespoon of sugar is taken in 1 week time. So it is hardly any sugar which the patient takes. And that is why in his regular diet also, he's taking probably more sugar in that proportion. So homeopathic medicines do not increase the sugar content. Rather, it helps in various other problems, like getting rid of the side effects of diabetes itself. So homeopathic medicines are very important for diabetics also.
So you could also say that you can take the tablets, that is the other, from there only another question arises. Normally we give 2 tablets or 3 tablets, say 2 times a day or whatever it is that our doses is, even of placebo. Then we have to let them take 1 tablet. Okay, so they will,
Correct.
your next question will be, how you have reduced my dose, how will it be effective? So that you have to explain to them about homeopathy, right?
Correct.
The principles. So you will explain to them. What will you tell them?
Well, the explanation about homeopathy is like what Dr. Shobha said, that when you take a homeopathic remedy, even if you take 1 tablet, it gets into the mouth and it touches all the nerve endings which are there in the mouth. So the effect of the medicine is directly taken by the body and by the nerve endings. And that is how the target organ also gets the message of the medicine, that the medicine has acted. If you see the literature in homeopathy, Hahnemann used to take a 10-number pill, and it was only a single pill put in the mouth and the effect was produced. We have read this in so many cases of how phytoleca was given as a single pill. And I've seen my homeopath teachers do that, that patients who have these kinds of diabetes or conditions where sugar is probably not tolerated much, they give in either in that form as a one pill, as you say, or they give it in a drop doses of the medicine itself. So apart
So
from,
then
if
you
you
come
don't
to
want to
the
give bottles,
principle of quantity versus quality, that homeopathy does not work on quantity, it works only on the quality. So whether you
yes,
take 1 pill, whether you take 2 or 3 pills, or you put that 1 pill in water in a glass and take it every day, one spoon, it's all going to have the same effect. This is what they find very difficult to understand and accept, but all of us are practitioners. So is there any other way anybody wants to suggest where they accept easily? Dr. Ketan?
One more question, that can we take onion or strong smelling food
You
along with?
answer this question first. That you have to convince them that taking it, so little quantity that it is fine, still fine.
See, single dose means whatever tablets you take at a time, whether it is 1 piece or 2 piece or 3 piece, it's not matter. But whatever you take single time at a time, that's meaning 1 dose. So this quantity problem is not that much important.
And that's why, this also we can explain, like, many a times the patients come and ask us, the small children they have taken the full bottle of a tablet, meaning because the children love homeopathic globules very much. And that is how the mothers worry a lot, thinking what would happen? Will they get any side effects of this medicine or anything would happen? So again, that is the time again we explain that, because homeopathy works with 1 globule or 1 bottle, that itself means 1 dose only. So that is how nothing to worry about that. So that is how we can minimize the dosage of pills per dose.
That is how we tell people that we don't go on quantity, because homeopathy is not acting directly on the germs which are there or whatever. It is acting on the body to stimulate it to act and fight the disease. But normally we we explained, right? That we
Yeah.
can,
Yes, yes.
that
It would,
we,
yes. Yes.
that we know that the
Homeopathy medicine would increase the immunity power of the body itself, and the body would fight against, the body's defense mechanism would be increased, and it would fight against those bacteria or the viruses and eradicate them. And
therefore if they try to say that the allopath shows in a petri dish one germ and one antibiotic, it kills it. That will not show in homeopathy. That is again one
Yes.
allegation which is there, right?
Very true.
Yeah.
Very
So
true.
we have to say that that does not work. And from
Yeah.
that would be that it is very individual, it is acting only on the person. Then there are so many myths Dr. Ketan was trying to tell us, that so many things are
Yeah,
avoided.
should we take a strong smelling food like onions or garlic like that, coffee?
Coffee, yes.
If correctly selected medicine that work in spite of taking this whole thing. So you can consume along with homeopathic medicine, you can consume coffee and strong smelling things also. I advise my patient to take some gap between medicine and these strong smelling things, only that.
The best time for homeopathy is when the body is not doing anything, get up in the morning, late at night. That is the best time to do it, when your mouth is clean. Otherwise, after it's active, then whatever you put in after 2 hours, there's no problem, right? That's what you're saying.
Right, right.
So that is
Basically, your mouth has to be clean, and that is
Yeah.
how.
So that
When
is
I said about, because the absorption starts from here itself. So if once your mouth is clean, you can take that.
Immediately after taking medicine,
what
you
is the
should
basic
not take anything.
What is the basic principle of homeopathy on which it is based? Why is it so controversial? Why is it so different?
There are three basic things, I think. One is the law of similia, which was arrived at by Dr. Hahnemann. It was a law which was there right before, like during the Hippocratic times and Paracelsus times. And from there is where Hahnemann adopted that. But nowadays, the science has gone into a different zone. Like it is more of a maintenance therapy now we are looking at in conventional treatment. So, and homeopathy is more of a curative type of treatment. So this is one controversy which is always there, that what does law of similia mean? And people don't understand. So many times I ask my patients or even my students that if you want to test law of similia, simply you take 3 bowls of, you can eat things which are very easy to eat. And you take them in enormous quantity. Like when I was in the hospital and Dr. Prakash Vakil made us eat 2, 3, 4 watermelons every day. We were only supposed to eat watermelons and nothing else. No chapati, no roti, nothing. And people develop symptoms like I myself developed a big tumor behind the ear, and it went away after the watermelons were stopped. So law of similia is so easily seen when you experiment on yourself. But patients have to be understood that this is what it is. The second problem is law of minimum. The minimum quantity that we already spoke about, that the medicine basically touches your 4 basic systems in the body, which is responsible for your body to grow. The immune system, the psychology, the nervous system, and the endocrine system. So these are the things which the homeopathic medicines touch. And that is where the controversy comes, that how can bacteria and viruses get treated? But as Dr. Shobha said, that these medicines, they touch these systems. And through these systems, the vital force, it enhances the immunity to become to such a level that it tries to remove the disorder. And once the disorder is removed, the disease goes away. It is so easy.
So why is it so controversial? Why do you constantly get some attacks on homeopathy? Any
So the third
Dr.
thing is the
Jagor?
medicines.
Well, because we cannot demonstrate how, according to modern scientific method, how our medicines act. That's our main drawback. You see, if we can do that, then I think so. Our system could be accepted by the allopathic doctors. Being dynamic in nature, it is very difficult for the allopathic doctors to understand the dynamicity of our homeopathic medicines and the way in which it enhances the immune system and it fights the body.
So that means that
मैडम मैं तो इतना ही बोलूंगा कि जब आप ग्रो होते हो तो लोगों की नजर में आते हो और कई लोगों को उससे नुकसान होता है,
Very
तो
true. I
उनको
agree.
अच्छा नहीं लगता है कि आप ग्रो होके उनसे आगे निकल जाओ,
टक्कर मार गए, टक्कर मारते हैं.
Yes.
इसलिए ही शायद ये है कि इतना कंट्रोवर्सी होता है.
So,
Yes.
Dr. Banker, I remember when I went to America, I read the history of homeopathy in America. Would you like to tell us about that?
Yes, so homeopathy was excellent in North America. When I say excellent, I mean that there were so many homeopathic colleges, I would say around 10, 12, or maybe
17, I
more
think.
homeopathic colleges. And there were more than another 15 homeopathic hospitals. So homeopathic colleges, homeopathic hospitals, and so many practitioners doing homeopathy, beautiful. Like you see Dr. Kent, Dr. Grimmer, and there were a host of others. And there were homeopathic associations which were working on large scale. So homeopathy was excellent in North America, and that includes America as well as Canada. But because of, like Dr. Ketan said, that because of one particular Flexner report, and they converted, they made it a law, because the other system, the conventional system at that time, was not getting enough response because there was so much homeopathy here. And so they tried to do a political law in which they said that anybody who wants to practice medicine can only do so if he is qualified from the medical college. And because of that law and because of some other parallel laws, homeopaths were not able to practice legally in North America. So until 1922, this was the scenario. After 1922, it changed. And that
What
is
you're
how
saying is,
homeopathy.
what you're saying, Dr. Akshay Banker, is till 1920 or so, homeopathy is quite flourishing. And then
Excellent,
between
excellent.
1920, when the Pharmaceutical Association became very strong, that it tried to kill homeopathy. All the colleges shut down. They were turned into allopathic colleges. And then
Yes.
only till for 50 years, there was hardly any homeopathy and everybody was against it. Then in 70, I believe 1970 or so, that, it started again.
Homeopathy regained, yes.
Yes.
Homeopathy again started coming into the mainstream.
And that was only survived by some nurse practitioners and such things.
Right.
And then finally, but yes. So in India, of course, there is all these qualifications. Would you like to talk about it, Dr. Ketan, about qualifications, about on homeopathy?
कई बार पेशेंट हमारे पास आके पूछते हैं कि अगर आपसे ठीक नहीं हो तो हम डॉक्टर को दिखाने जाए, तब मुझे बोलना पड़ता है कि मैं भी डॉक्टर हूँ. एक्चुअल आफ्टर इन इंडिया, आफ्टर पासिंग 12, वो भी आपको साइंस के ही सब्जेक्ट से पास होना पड़ता है, फिजिक्स, केमिस्ट्री एंड बायोलॉजी, और आपको नीट की एग्जाम क्लियर करनी होती है, और जो भी नीट ने जो मार्क्स तय किए होते हैं उससे आपको क्लियर करना होता है, तभी आप एडमिशन होम्योपैथी में ले सकते हो. तो 12th में साइंस जरूरी है, नीट पासिंग जरूरी है, और होम्योपैथी में जब एडमिशन लेते हो तो आपको 5.5 years, 5.5 साल तक आपको पढ़ाई करनी होती है. इसमें फर्स्ट 4.5 year कॉलेज में स्टडी एंड 1 year इंटर्नशिप. और मैं आपको बताता हूं कि होम्योपैथ जो पढ़ाई करते हैं, जो एमबीबीएस वाले जो पढ़ाई करते हैं, वही सब्जेक्ट होम्योपैथी में पढ़ाए जाते हैं, जैसे एनाटॉमी. इवन होम्योपैथिक कॉलेजेस में भी बॉडी लाते हैं, डेड बॉडी, और उस पर डिसेक्शन बताते हैं. तो एनाटॉमी, फिजियोलॉजी, सर्जरी, गायनेक, पीएसएम, ये सारे सब्जेक्ट्स होम्योपैथी में पढ़ाते हैं. सिर्फ हमें देखना यह है कि हमें हमारी फार्माकोलॉजी पढ़ना होता है, जिसको मटेरिया मेडिका बोलते हैं. बाकी पेशेंट के डिजीज का डायग्नोस करना और वो वो डॉक्टर करते हैं उसी तरह हम भी करते हैं। हम भी अपने पेशेंट्स को ब्लड रिपोर्ट्स वगैरह करवाते हैं, उसके भी एक्सरे या सीटी स्कैन या एमआरआई वगैरह करके हम उस पर से भी डायग्नोसिस करते हैं, तो डायग्नोसिस सेम रहता है।
That raises another problem, Dr. Ketan, because patients sometimes don't want to do investigation. They बोले इतने सब करने का, सर्जरी में जाने का, हम होम्योपैथी लेते हैं, फिर आप भी कराओ तो पहले से ही
मैडम ऐसा होता है, जो एलोपैथी से थके हुए लोग हैं ना, वही हमारे पास आते हैं। उनके
वही
पास
तो,
पूरी
तो
फाइल्स होती है, तो
investigation
हमें
नहीं
कुछ
करना
करवाना
होता
ही नहीं होता है, हमें सिर्फ उनके
है,
सेटिस्फेक्शन
समझाना
के
पड़ता
लिए
है।
इतना होता है।
I believe you have made a nice video, Dr. Ketan, to give your patient to explain what is homeopathy, you know, basic things. Because sometimes they come, they don't even know properly. And so you made a nice video that you can, if you want, if the audience wants, you can share it on our Telegram group of NJH or something, which shows that it is important that you understand what is homeopathy, that sometimes when investigations are required, we will be giving the investigation, and sometimes allopathy and homeopathy can go together, like Dr. Akshay Banker was talking about diabetes, that you can give that medicine alongside. So who please take up the question of allopathic medicine, do they have to be stopped when taking homeopathy? So that is a question which is there all the time.
No, ma'am, not in all the conditions. Meaning we have to decide about the conditions, especially those patients who are on to the antihypertensives, anti-diabetic medicines, or who are taking medicines for thyroid or any other conditions, which are the chronic diseases. Yes, epilepsy, even some autoimmune diseases. We do not tell them to stop, like as soon as you are starting the homeopathy, you're not supposed to stop all the allopathy medicines. But gradually, once you are on to homeopathy medicines, and when your disease starts coming under the control with the homeopathy medicines, that is the time, like we have seen in a lot of patients, that when they are also visiting their allopathic consultant at the same time, and they themselves would reduce. Yeah, like this is very commonly seen, especially in the cases of thyroid, whether it is hypothyroidism or hyperthyroidism, that homeopathy works really wonders, and their medicines which can be reduced, and gradually it also stops. And
but
then
the other problem with these diseases is that once they do homeopathy, because you should monitor them, and once
yes,
they
exactly,
homeopathy, they don't monitor it. So it is always advisable probably to tell them that these are very chronic diseases which can come even if you feel they are coming. They are doing it very scientifically, reducing it, but you have to continue to monitor yourself every 6 months or
yes, ma'am. Yes, ma'am. That is very, very important. And we need, even when they are coming to us also, we need to monitor it regularly. And otherwise also they should be told to, in the beginning of the treatment itself, that even if they stop coming to us, they should monitor themselves periodically with the laboratory investigations.
So what is there any scope that homeopathy has, that it treats these diseases, does not treat these diseases? That's what people ask you. No?
Yeah. So mainly all the medical, meaning the diseases which can be treated medically, all those conditions can be treated with homeopathy also. Like, and some
which
of them.
diseases, Dr. Ketan, which you would tell them that yes, we may not be able to treat?
स्कोप ही स्कोप है, सारे होम्योपैथिक में बहुत सारे स्कोप है, बहुत सारे आप बोल सकते हैं स्कोप नहीं है, ऐसे बहुत कम डिजीज है। सर्दी से लेके कैंसर तक, फ्रॉम कॉमन कोल्ड टू कैंसर तक वी हैव अ ट्रीटमेंट, बट आवर सिलेक्शन शुड बी परफेक्ट, राइट? Our medicine selection should be perfect. That's the main importance. Many injury.
Everything.
So what I usually say, tell my patients is that homeopathy can help you for any kind of condition that you come to us with. Means like Dr. Ketan said, common cold to cancer. But when we speak about cancer, then a doubt comes whether homeopathy can treat cancer. So there, as I said, we help the patient with all kinds of diseases. We don't say we cure all the diseases. Means there are conditions like cancer, like other, like diabetes, like high blood pressure or other conditions, which are probably more strongly affecting the body of the patient, and they are difficult to treat and totally cure. So similarly,
Yeah.
cancer in the first, second stage, I've seen in my patients that people who have been diagnosed as positive biopsy for cancer, and they have become negative for cancer. So cancer can also be treated, but there are other aspects also, like surgical diseases that we spoke about a minute back. Surgical diseases, homeopathy can help in cases which are reversibly to be cured. If the case is very prolonged, if you have a case of hernia and for a very long period of time, then you cannot cure that case. But homeopathy can be useful before and after surgery, which is again an added advantage.
Before, during, and after.
Yes.
Same
After
way in
surgery,
cancer also. In the
yes,
advanced cases, we can just palliate the patient, give the relief of
correct,
our medicine. And
correct,
when
correct.
in suppose chemotherapy or post-cancerous state, even we can help patient in for many side effects of that chemo and in that condition.
So before and
Yes,
after. So what you're saying is we should go hand in hand. We don't
correct.
always, that is what the conclusion is. We should go hand in hand. They work at different levels. So they don't clash, which is important to, stress on the patient that it is not that, because if you tell them stop everything, sometimes I've seen, some people dying because the homeopath told them stop everything and they
Yes, yes.
landed into a crisis. So yes, you can taper later on, or even if it goes on, as long as the patient is monitored and keeps within that, it should be our aim should be to work together and to see that the patient is safe, right?
Correct. That comes to the point, madam, that we homeopaths are not at fight with the modern medicine or with any other therapy per se. Because finally, all the doctors of different system of medicine want to give a best possible treatment to their patients. And when the integration is done, especially in those difficult diseases, integration helps a lot to the patient finally. So there is no fight between any therapies, I believe.
Everybody should go work together.
That's right.
Correct.
So why do we say it is safer than allopathy? The big thing we say is it is not slow, it is fast, it works, it's holistic, it helps to cure the patient, build up the immunity. Why is it safer than allopathy? That's the other thing.
Because
promote.
in homeopathic medicine में chemicals नहीं होते हैं. This is only energy. होम्योपैथिक मेडिसिन जो एनर्जी होती है, आप नहीं मानोगे कि पोटेशियम साइनाइड मैं 2 साल के बच्चे को भी दे सकता हूँ, बिकॉज देयर इज नो क्रूड सब्सटेंस. इट्स ओनली एनर्जी जो स्पेशल मेथड से वो उसकी एनर्जी को लेके दवाई बनाई जाती है.
It's the true atom bomb theory that you have working only on the energy level. So there is no crude substance, and therefore the side effects are normally
no side effect.
That is why the side effects are not there. Because people say that because there are no side effects, how do you know there's effect? So our main thing is about placebo, right?
एलोपैथिक में तो दवाइयाँ जो होती है वो आउटडेटेड भी हो जाती है. आपने देखा होगा कि एक समय पे जो एंटीबायोटिक यूज होती होगी वो कई समय के बाद आउटडेटेड हो जाती है. होम्योपैथिक में आज तक एक भी मेडिसिन आउटडेटेड नहीं हुई है, मतलब वो इक्वली इफेक्टिव है.
और इतना ही नहीं, मैंने तो सुना है कि 50 साल पहले की दवाई भी काम करती है.
जरूर, कोई एक्सपायर डेट नहीं होती है.
The same medicine, I have gone to America. That time I had seen the previous generation homeopaths medicine chest was still being used. But today they are putting your stamp that you have to put dates on that and expiry. So what is your answer to that?
Correct. So that also comes to the point of explaining how the homeopathic medicines are prepared to the patients who do not know. When we say we can give poisonous substances also, but then if we explain to them the dilution which is made 1:99, then we can understand the potency that we give is normally a 30 potency or a 200. But the first potency was made using only one part of the crude substance and 99 parts of the vehicle which is used. In our case, it can be alcohol or it can be sugar of milk or lactose. So that makes only one potency. Second potency is prepared by taking one part of the first potency and 99 parts of the vehicle. So that is how the dilution is constantly made. And by the time the patient gets 30 potency, that is where we call the Avogadro law, that after potency 6, there is no molecule of the drug substance remaining. Now, from this point again comes to another, what we spoke about nanoparticle. It is all interconnected. When we talk about one thing, the other thing naturally comes up. So if anybody can talk about the nanoparticle, any research thing.
And yeah, Dr. Jagos.
Well, regarding nanoparticles, people have done research and have shown the effectiveness of homeopathic medicines and the probable way how it works. So I think so still further research is required in this area. And some people are trying to do that from IIT as well as from some other organizations. And I feel it's still in the budding stage. It requires some more time or some more research to come up with something or concrete data.
So what you're saying is that earlier we used to say there are 2-3 things which come out from here. One is that, when you talked, Dr. Banker talked about potentizing so much. So the common thing is that 30 potency is like one drop in Powai Lake. Now all of Bombay or any small lake. So it is like one drop. Then what is the point? But it works, no? Your atom bomb, when first birth, did anybody know it would create so much havoc? Same thing, because it is so controlled and so small, it can act. That is your first point. Your second point is that how can you tell then if you don't know, if there is nothing there after avocado's law, then how do you know which medicine it is? So we had scientists from IIT who took up this project, and they proved that there is energy levels which can be quantified, and that they can be quantified and associated with a particular medicine. That is what Dr. Jagos is trying to tell us, that we can know that which medicine was there, and we can also prove that. Okay, so then our next question then.
And ma'am, along with the dilution, what happens is the method in which it is prepared. So it is the potentization, which happens is as soon as the dosage of the crude medicine goes on reducing, but the energy level goes on increasing. And that is how it becomes more and more energy, more and more triturated and potentized. They are more and more energy levels there, and
Yes.
more and more effective in any conditions.
Very true, Dr. Shobha. And because the controversy also comes whenever people speak against homeopathy, they always talk about diluting the substance to a very great extent, but they don't talk about the succussion part, the potency which is being made. Alongside, every time there is a dilution, there is also succussion done. That means apart from dilution, the energy is also liberated.
Yes.
And that is the process which comes in totality, that the homeopathic medicines become more effective.
Yeah.
Yes,
So
Dr.
that
Ketan.
potentization, succussion and trituration process of preparation of the medicine is
So
very
then
important.
how does that help the aggravation? This kind of process, when aggravation is the one other controversial subject, that homeopathy, lots of old timers used to say, "Pehle sab bahar niklega, fir acha hoega." What is your answer to that?
Mainly that's happened with skin disease. What's happened in skin disease, we give a medicine and ask to patient stop that local application. तो लोकल एप्लीकेशन बंद करते हैं और हमारी दवाई जाती है, और हमारी दवाई एक आर्टिफिशियल डिजीज बॉडी में प्रोड्यूस करती है. तो पेशेंट का डिजीज प्लस मेडिसिन से जो डेवलप हुआ है आर्टिफिशियल डिजीज, उसकी वजह से कई बार लगता है कि उसका प्रॉब्लम बढ़ गया है. और दूसरा यही कि उसने जो लोकल एप्लीकेशन बंद किया है इसलिए भी लगता है. तो जनरली ऐसे बातें हमने स्किन डिजीज में ही देखी है, बाकी और डिजीज में इतना नहीं देखा है कि डिजीज बढ़ जाता है.
आप आर्टिफिशियल डिजीज बोलोगे तो मैं डर जाऊंगी कि मुझे आपने आर्टिफिशियल डिजीज दिया, तो उसका क्या जवाब?
वो इतना अच्छे से दिया होता है कि थोड़ी देर में उसकी इफेक्ट चली जाती है और बॉडी को वो एनर्जेटिक करता है.
Artificial means you mean that we have full control on that. We are giving that to produce the same thing as what the natural disease is. takes hold
Correct.
of the same parts, and
Hmm.
then the natural disease goes away. Because
Yeah.
in nature, the stronger force extinguishes the weaker force. And then after that, we take away the artificial, so patient is cured. That is
Right.
your explanation, right?
Yeah. Right.
Ma'am, that is what Dr. Akshay Mankar also had said, no, that he got some tumor behind his ear when he was taking too many.
Just watermelon, not even potent time. Just
Yeah.
watermelon.
Yeah,
Yes.
yeah. But which disappeared once he stopped that, so that is what it is like, what Dr. Ketan sir was saying. Ma'am, I also wanted to say about the first thing what Dr. Ketan sir you said, first part of it was about
Local
That
application.
the local application, yes. So, ma'am, what happens is that with the local application, what happens is the condition, the skin condition, whatever has been tried to, they are not cured. So, what happens? They are almost like a suppressed. So, it goes below the carpet. And as soon as we stop this local application, this disease condition itself tries to come up on the surface. So that is
Correct.
how many a patient feel that it is because of the homeopathy. It is not because of homeopathy. It is because of the stoppage of those
Stoppages.
local applications. Whatever was suppressed, it is coming up. At the same
Correct.
time, this is not observed in each and every case of the homeopathy that, they get the aggravation. It is
True.
seen only in very, very few or rare cases, like out of 100, only 1 or 2 patients can come up with this
So
type of
why
aggravation.
is it today so much less aggravation than before? Why the doctors were better before, so they brought or the doctors are better today? What is it?
So now most of the patients, if we are trying to understand the patient's conditions, the patient's, the general vitality, how many dosages they require, and then if we are giving the dosages which are properly, accurately given, then there are less chances of aggravations. But if they are
matching the power of the patient with the power of the medicine.
yes,
So you're
like
trying to reduce
it
the
is-
aggravation.
yeah, ma'am, it is like in allopathy also, many a times when the physician is prescribed any medicine, there are some patients who would keep on taking the analgesics, painkillers. अरे वो घुटनों में बहुत दर्द था, डॉक्टर ने पेन किलर लिख के दिया था, उससे मुझे रिलीफ मिल रहा था. They keep on taking those medicine and it would give rise to increased creatinine or effect on the kidney. That is how, if patients are, abusing the medicines in a wrong way, whether it is a homeopathy or a allopathy medicine, then it can give rise to the difficulty. Otherwise, it should not.
I would like to add here, one point is that homeopathy has evolved so much in all these years, and the chances of following up with patients is so much that when a patient comes to us, then we are able to follow up with the patient more often than what they were able to do maybe 20 years back. So patients, even they have a small problem, they communicate with us during the treatment. And so we are able to understand the response the body of the patient is giving. This is one point. Second point is that when patients come to us, they come to us, like Dr. Ketan said, after having been suffered for such a long time. So they have already had layers of various sufferings in them. When we give a remedy to the patient, then it is the old suffering, because when we give a remedy, it tries to detoxify the body. And when this detoxification of the body is taking place, then the patient will start having symptoms coming out, and they falsely call it as aggravation. But it is probably not aggravation, but the old symptoms are coming out because the body is getting detoxified. So you have fever or skin complaints coming out. But when there is a follow-up and a communication between patient and the homeopath, then the homeopath is able to understand that this is not the new symptom coming out. This is not the side effect. This is not the aggravation, but this is the recovery which is taking place in the patient. So if we can explain to the patient that this is the recovery, and I have seen this in many of my patients of psoriasis or vitiligo, that whenever they had fever coming up, after every fever, there was a relief and further progress in the healing of the disease part. Every time the patient had a cough, which he had years back, the cough comes up and the psoriasis eruptions get better. So basically, these symptoms which come up, which look like an aggravation, are not aggravations. They are old symptoms coming out of the body, the suppressed symptoms, getting rid of the body. So body is detoxifying and getting cured. This is what
and also
is my
bringing out
understanding.
the old diseases which we said were suppressed. They come out
Correct.
and then they go away. That is your.
Correct.
Yeah.
But
So
that. So from
basically,
there one other point comes up is that then all your cases are like contextual. You're saying you did this happened to your patient. So it is all stories. Are they really? How do we think? And the most important thing about homeopathy they bring out that it is not scientific. What is the truth? What are the researches doing? So, Dr. Jagos, would you like to throw some light on this?
yeah, sure, ma'am. Well, the research, I don't think so many conventional doctors know about CCRH, that is Central Council of Research in Homeopathy. It is a branch of Ayush, Ministry of Ayush, Government of India. They are doing good research work on those diseases which have no cure or less cure or less success rate. So the Scientific Advisory Committee from time to time advises CCRH what to do. So CCRH basically, they generate, they validate, and they consolidate scientific evidences in terms of safety, efficacy, and effectiveness of homeopathic medicines, preparations, and treatment regimens. The aim is to carry out research or trials on modern scientific basis, like the double-blind method, objective assessment, statistical analysis, without much interfering with the doctrines of homeopathy. More emphasis is laid upon the clinical evaluation of homeopathic medicines in disease conditions which have no curative treatment available in the conventional system of medicine. And one major activity, they have upgraded themselves by doing you can say they have traversed from the prospective observational study to the gold standard randomized control studies. So till date, approximately 211 studies have been carried out, in which 178 studies are concluded and 139 still are under, or rather 13 studies are still undergoing research. Well, the salient features in which clinical studies have been done are HIV, AIDS, ulcerative colitis, bronchial asthma, cervical spondylosis, acute rhinitis in children, and not to forget COVID-19 also. Well, if you can see, the research done by the CCRH in migraine, assessed by the MIDAS scale, it shows cure rate of 72%. Tension headache, assessed by H6 scale, cure rate is 84%.
I think these researches were done in the Palghar hospital also, some of them. This list of researches were done in Palghar hospital, homeopathic hospital, where so we know that everywhere there's research going on. So yes, tell us about what all were done at the Palghar hospital.
Then hypothyroidism by using thyroidinum 3x, in which TSH was normal in 32% cases, and with constitutional medicine in 65% cases.
So all of them, all 100% improved.
Right.
That means.
Then quality of life in diabetes mellitus, assessed by the SF36 scale, improving percent is 68% of the cases. Vitiligo, assessed by the Vasi scale, in focal complete cure is 56%, and generalized improvement shows 34%. Osteoarthritis, assessed by the Womack scale, improvement is 68%. So you can see the results are quite encouraging with homeopathy. Even the Central Council, CCRH, has done, I mean, there are many researches which they have done, but I would like to highlight one to give an example. They have done a retrospective study of homeopathic treatment in patients with heel pain with or without cantharidin spur, which was published in the Indian Medical Journal of Homeopathic Research in 2017, volume 7, pages 64 to 73. Well, in this, the methodology used was that it was done over a period of 6 months. The retrospective study was done by Dr. Anjali Chatterjee by the Regional Institute of Homeopathy, Kolkata, and samples are selected from patients referred for ankle X-ray from August 2014 to July 2015 for non-traumatic heel pain. Their files were traced from outpatient department, and treatment records were received over a period of next 6 months. The results were quite encouraging. totally 92 patients, out of which 70 were women and 22 were men. They had undergone lateral X-ray of the ankle joint, out of which 76 patients had the calcanean spur. The extent of calcanean spur was found out to be higher in case of females, older age, overweight, and professions of housemaid or manual labor. Homeopathic treatment showed positive results. Of nearly 75% of cases responded to the calcanean spur patients. The medicines used were Calcarea carp, Calcarea floor, Rustox, Ledum pal, and Arena diaderma. To conclude, calcanean spur was found in nearly 80% of patients presenting with heel pain, which showed association with female, sex, overweight, increasing age, and professions requiring heel stress. Homeopathic treatment was effective in 3/4 of the cases, the major remedies being Rustox and Calcarea floor. So this is one example of CCRH. Of course, there are many. If you go to the site, there are many.
So you're saying that it is there in the public domain, that you can see that homeopathy research is being done. So now, the thing is that why is it still being said not enough research? Mainly, I think it is because the research which is done is quite different from how the allopathic research is. Normally, they would take, for example, like you quoted thyroid, they would take 30 patients of thyroid, 30 patients of control, give the same medicine and find a result. We may, like you said, constitutional remedy. So it would be different in every patient. And you would still take 30 control and 30 patients, and you will see the difference between each patient. We may give the constitutional or give thyroid, Ledum 3x, and then see between that and the control. So the same principles are being followed, except that the medicines are being chosen individually. That is what you're saying.
Basically, individualization is the essence of homeopathy. That's right.
Yes. So there is
Can
enough
I add-
research. Yes.
Can I add something? Because since last 30, 35 years or more, there have been hundreds of studies which were done worldwide. And there have been cohort studies done, observational studies done with homeopathic medicines, compared with the allopathic medicines for the same disease. That has also been done. There has been research in veterinary treatment and agriculture treatment also. One of the very important studies that I would like to draw attention is the study which was done by the departments of cancer biology and laboratory medicine at the University of Texas, MD Anderson Cancer Center, which I think we all know, which was done by the doctors over there, along with the doctors over here from Calcutta, the Pradeep Banerjee and Prasanta Banerjee, about Ruta 6 given along with Calcarea phos 6x. And it was seen that it was a novel treatment for human brain cancer. And it was 15 patients who were diagnosed with intracranial tumors were treated with this Ruta 6 and Calcarea phos 6x. Of these 15 patients, 6 of 7 glioma patients showed complete regression of tumors. And both in vivo as well as in vitro, the results showed induction of survival signaling pathways in normal lymphocytes and induction of death signaling pathways in brain cancer cells. So this was very remarkable. Even nowadays, I receive phone calls from people asking me that, do you have Ruta 6? Do you have Calcarea 6x? So Calcarea phos 6x. So this particular research, which is of not too long, but has ignited that thought that homeopathy is useful for various disease conditions.
Yes. This also.
And there are many others.
Yes. So this Calcarea phos 6x and Ruta, I personally, how I give it is take the Calcarea phos 6x and put the Ruta 6 drop and give it. And it is also very useful for ACL, for ligament tears. And we
Yes,
have
anterior
documented.
cruciate ligament.
Yeah, where you
Tear.
tear it completely. So yes, so these are kind of researches. So everywhere there is enough evidence that
Yes.
homeopathy is working. It's not just anecdotal. It is not only
Yeah.
contextual. It is got everywhere. Research is being done, and we have to, be able to take this research, because if somebody's eyes are closed and they want to say no, then you cannot help that person. But if you
Correct.
want to be convinced, you can be convinced, because there is enough research. Your answer to placebo and the French research that was done in water,
Hmm.
anybody on that? So placebo effect, na? So placebo effect, I like what one senior homeopath, a colleague of ours, said, that
Hmm.
if placebo can cure, then nothing like it. Na? Then there is no problem. Let placebo cure. Why should you be unhappy
Correct.
about
Correct.
that? Let it cure, as long as the patient is cured. But it's not always placebo effect, as we saw in the cases quoted by all of you, that even children, even animals, now they don't know this is placebo or not placebo. So if you
Correct.
get well, and so are
तो
there any questions with the audience?
वही बात है मैडम कि रिसर्च की भी जरूरत नहीं, जिस तरह से लोग होम्योपैथी की ओर जा रहे हैं आप देखोगे तो होम्योपैथिक फार्मेसी का भी बिजनेस बहुत बड़ा है, और हर एक डॉक्टर के पास आप नहीं मानोगे कोई ना कोई एलोपैथिक डॉक्टर्स या तो उनके फैमिली मेंबर्स भी ट्रीटमेंट के लिए जाते हैं, वो खुद पेशेंट बेचते हैं। कई एलोपैथ डॉक्टर्स भी होम्योपैथ प्रैक्टिस में टर्न हुए हैं, और हमारे जो स्थापक थे डॉक्टर हनीमैन साहब, वो खुद एलोपैथ डॉक्टर्स थे। तो जिस तरह से होम्योपैथ साइंस आगे बढ़ रहा है वही दिखाता है कि उसकी क्या पोटेंशियल है।
Oh, there was one, what you're talking about is that when in Switzerland, where homeopathy is quite popular, they had tried to not take it off the national insurance scale, where you can claim, and they had wanted to take homeopathy off. But the public revolted against this law, and they had to take a full, cognizance of that, and then they had to send out a thing, circular, and get data, and they found that 72% of the population wanted homeopathy. So we're talking about not only India, where people have a lot of faith, and but also many 170 countries also practice homeopathy. So your next question would be: is there some country which bans homeopathy?
Country which bans. No, I have not heard of.
Gulf country are
There
more
are individual
vigilant,
instances,
but not
no.
one, but they are more vigilant
Strict,
for
yeah.
the medicine. Yeah.
So
You can
it
treat
goes
a limited
under,
number.
I think, natural medicines. It has to be practiced under some
Yes.
other heading.
They practice under herbal medicines, I
Under
think.
TCAM.
So they can practice.
Yeah.
There
And
are
you have to
people.
be careful what disease you're treating. Every disease abroad you cannot treat. According to the country's rules and regulation, you have to treat
Yes.
accordingly. That's very important.
And not claim anything.
Absolutely,
Like
absolutely.
we are not supposed to claim that we can cure the disease. We can only say that we can help you with this problem.
Yeah.
So
And
we can't claim.
so we have talked about all the myths which are going on. We have talked about all the problems which people face, all the questions that homeopaths face. We've talked even about education, where it is on par. You no longer have just lay homeopaths like you had earlier. Not that lay homeopaths are bad, because finally education is study, whether you do it on your own or you do it in a college. But still,
Correct.
we are professionally qualified. They are equal, and we've talked about research projects, and we've established that if people should, allopathy, homeopathy, whatever other branches, should all work together to get
Integrate. Yeah.
integrate and get patient well. Our whole idea is to, there's not a fight between anybody, but that you should integrate and get it well. And
Correct.
of course, we haven't really talked about the steroid, which is one other very common question.
Yeah.
Yeah.
Throw some light on it.
Yes.
That's a very common question, which all the patients ask the homeopathic doctor, doctor, do you keep steroid in your medicine? So you very confidently tell them that, no, you have to believe in me. If you don't have trust in me, then you can go ahead and you can test it in the lab. So basically the two tests which are used. One is the calorimetric method test using tetrazolene blue salt test, which gives a false positive result. So whenever the patient comes, you must tell the patient, do not test this powder or this medicine with this tetrazolene blue salt test, but you have to go in for the Liberband Bouchard test or the TLC test, that is the thin layer chromatography test, or the UV absorption test. If you use the tetrazolene blue salt test, it is basically a colorless dye in the oxidized form. When it gets reduced, it becomes pink in color. So when the dye is put in the sugar of milk or lactose, it gives in proportion a compound known as framazan, which is in proportion to the amount of lactose present in the sample. So more the lactose present, the pink color will become more higher, and less present, it will still become light pink. So there will be a color difference, but ultimately it is pink, and it shows that it gives a false positive result. So that has to be taken care of. And if in the UV absorption method, all steroids, which by this test, if a steroid is present, it will show a value between 235 to 240 nanometers will be present. In this value, it shows that steroid is present. So, and of course, our medicines with this test, they do not fall under this category. And this is a very reliable test. Not only that, you must tell the patient to do it in an FDA approved lab, because to perform this test, you require sophisticated instruments, which are very expensive. So the ordinary lab, which are not FDA approved, may not have such high-end machines. So the result will be compromised. Not only that, the last point is also that all homeopathy doctors, they buy from a reputed company who follow the GMP practice under the schedule M1. Under this schedule, all the medicines, they are sealed. So the chances of adulteration or compromising the medicine is absolutely cut off. So that's also an important part. So tell the patient to do the steroid test by the TLC method and not by the other blue dye method. That is very, very important.
So we are saying two very important things is that there is a definite way of doing a test if somebody wants to do it, and also that you must follow the whole thing. By saying somebody have faith in you, they're not going to have faith. So you have to tell them a scientific test by which they can prove it if they want to do it. And also, so I have a simple, I take a glass of water, a glass of water with plain water, which you can see. I put the homeopathic pill, I take another glass and put any allopathic pill, including steroid. And so a dispersible, you get in allopathy now also sweet medicine, right? You have 2-3 things which are very common for homeopathy. One is that it is very small, it is very sweet, and it is odorless, tasteless, all that. So you can see that in the glass. Even in allopathy now they make medicines which are sweet. So that, but even if the dispersible, you put it in the glass of water, it will still have a cloudy appearance and not be completely clear. And the steroid also will have a residue however long you keep it. So these are some very simple tests. That is one. And secondly, about what Dr. Jagos said about going to reputed, of course, if you go by, you go by any small laboratory, you may get some impurity, and you may get some problems with the impurity, which can give you side effects. So you have to do that. As we say, for many years I've been saying, when people, they still adulterate, but there was once a time when they used to adulterate all grain. So did we stop eating? We didn't stop eating. We went to people whom we trusted to give us better grain. And even today, every day somebody comes up with adulteration. We didn't stop eating. So like that, you cannot stop homeopathy because one person does this. There will always be in one pack, there'll always be one wolf. In every pack, there will be one bad person. So based on that, you cannot stop taking homeopathy. And I think today we have proved beyond doubt, reasonable doubt. We should always say reasonable doubt from all this full panel, which is more than 170 years of experience all combined, and they face every possible question a patient can put to you, that we have proved homeopathy is trying to be as scientific, as logical, and not forgetting the art. We say homeopathy is art and science. So yeah, it cannot be just scientific, but we try to answer all the questions. And if somebody is open to accepting the answers, we have the answer. If they are not, it is their lookout, right? So there will always be these problems which will come up periodically, and we have to go on with it. And finally, the audience will stand by us, the public will stand by us, because they are the ones who want to get well. They are the ones who can see the effect and improvement. We have quoted so many cases, where a patient will come to you with depression and so depressed and say, I weep every day. And if a week later she says, I feel happy and I don't weep, now you can't call this placebo effect. You can't call it conceptual. It's not that looking at your face that they felt better. So it is that your medicine work, whether it is mental, it is physical. And like I always say, how does anybody survive without homeopathy? If, that we are all blessed to be homeopath. And today we have a wonderful panel which has cleared all doubts. If anybody had. Audience still has any doubts or anything in the chat box? Okay, so we have a question. Why are homeopaths not transparent? Yes, very good audience, very good. One question we didn't answer. Please answer, panel.
So here we do have patients who want to know about what medicines they have received. And they also want to know what this medicine does. Like I gave one child arsenic alb, 3 doses followed by ferrum phos 6x. And the father wanted to know what arsenic alb is useful for and what ferrum phosphoricum does. So, which is a very important aspect in modern day, because they have access to Google. They can look these medicines on internet, and they can know what it is for. It is good to be transparent on one side, but it is also dangerous, because we prescribe from our experience and from the materia medica knowledge that we have gathered, and which is more detailed than what you find on the internet. So patients can also have wrong impression and wrong knowledge of what we have given. And that is where the danger lies. So I tell my patients, do you want to know what you have received, or do you want to research what you have received? So there is a difference being knowing and for researching. If they know it well, it is good. This is what I do.
So I remember 30 years ago, I had a patient, and that I used to be a little transparent. And I said that, I've given you arsenic. You won't believe it. She left my treatment. Arsenic? The voice, I can't take it. They don't want to hear everything else. So there is a reason, right? Anybody wants to shed light why we are not transparent about disclosing medicines?
Generally, I say my patients that I will inform you medicine name after completing your treatment. I don't want to hide it. But क्या होता है कि वो जान के एक पेशेंट को मैंने ट्यूबरक्यूलिन प्रिस्क्राइब किया, तो उसको लगा कि मुझे कहाँ टीबी था, आपने क्यों ट्यूबरक्यूलिन दे दिया। हमें वो यहाँ इसरो में पेशेंट के नाम दवाई के नाम प्रिस्क्राइब करने होते, तो एक पेशेंट को स्टाई था, तो कोई डॉक्टर ने उसको पल्सेटिला लिख के दिया, और वो पेशेंट ने 3 महीने तक खाते रहा। फिर उस पर ही प्रूविंग हुआ, और वो पेशेंट बार बार बातें करते करते रोने लगा था। तो जब पेशेंट्स दवाई का नाम जानते हैं, तब यही प्रॉब्लम होता है कि उनके माइंड में कंफ्यूजन क्रिएट होता है, क्योंकि हमारी दवाई डिजीज के नाम पे नहीं होती है कि एसिडिटी है तो ये दवाई, ऐसा नहीं होता, बल्कि एक दवाई 500,000 डिजीज के काम में आती है। तो एक ही दवाई से बहुत सारे डिजीज ट्रीट होते हैं, और कई बार उसमें वो ट्रीटमेंट में नहीं भी लिखा हो तो भी हम अपने एक्सपीरियंस से वो दवाई प्रिस्क्राइब करते हैं। तो आप कहीं से जज नहीं कर सकते हो कि ये दवाई कैसे दी है।
And it is bigger than whatever the Google. So today they say you either be a Google doctor or be a Google patient, or you be a homeopathic patient or a doctor. So you can take your choice. You can go to Google and ask for treatment. No, why do you have to come to us? So when you're coming to us, keep that. And the only reason why we don't tell you the name, because that medicine is useful in so many things. I may give you for a cold, but it is for cancer also. So then you may say that I will get cancer if you give me a medicine which produces, and you say, So that is another drawback. Newspaper saying take this medicine, if you have this, if your hair fall, then they are used to allopathy where you can take it for a longer period of time. And so they may take it and get proving. So then we must give Dr. Banker's example of watermelon or chocolate. So, yes.
Yeah.
So is there any other question in the audience which you have not answered? So we have answered the steroid question. We have answered transparency. Is there the audience anything else? We have answered research. We have answered placebo effect. We have answered small minimum dose. We have answered every question that we could think of, right? In which disease is useful, if not useful. Why should you first acclimatize the patient to homeopathy a little bit before starting the treatment? Yeah. So next question is, sugar pills can contribute to what?
Raise sugar in diabetes.
So that also we have answered, that you can even tell them to take it in water. No? So then there is no sugar left in that. You can.
There is one question which is asked to me, that the patient says that I have been told by my allopathic doctor that there is no treatment for my problem. Can I be helped by homeopathy? So I normally say that whenever we study any particular system of medicine, that doctor will tell you the scope what that system can provide to you. So if you go to an allopath, it will be a different scope. If you go to a homeopath, the scope will differ. If you go to other system of medicine, the scope will differ. So if you are told that you cannot be cured by, or there is no treatment for your disease, you can always go to a homeopath, or you can go to other system of medicine, and they will be able to help you. So it is not that when one doctor says no, is always no.
You can say
because हमें है ना रोग के डायग्नोसिस की जरूरत नहीं है. We prescribe on symptoms based. तो सिम्टम्स अगर हम जान लिए और अगर हमारी मेडिसिन से मैच हो गया तो वो मेडिसिन वर्क करती है. तो डायग्नोसिस या रोग का नाम इतना जरूरी नहीं है. दूसरा कि माइग्रेन एलोपैथिक में बोलते हैं कि क्योरेबल नहीं है. अभी डॉक्टर जाकोब सर ने बताया कि रिसर्च में प्रूव हुआ कि 75% को हेल्प किया. तो एक साइड वो कुछ भी हो, लेकिन होम्योपैथी में रिजल्ट मिलते ही है.
Every pathy has its scope and the limitations. So similarly, the homeopathy, and in the homeopathy, we are seeing that there are a lot of complaints, lot of behavioral problems, lot of mental diseases where, or a lot of things which, where there is a limitation of the allopathy also, we are able to treat with homeopathy in a wonderful, wonderful ways. So like that is just, to bring that awareness in the general public that that is where also there is a scope of homeopathy.
और जो सिस्टम के बारे में आप जानते नहीं हो उसके बारे में कमेंट कैसे कर सकते हो. सपोज कोई मुझे आके पूछेगा कि आयुर्वेदिक में ये दवाई मैं लूं या नहीं लूं, तो मैं बोलता हूँ कि मुझे उसका आइडिया नहीं है, आपको उसके निष्णात को पूछो. तो उस तरह से कोई और पैथी वाले भी होम्योपैथी के बारे में कैसे बोल सकते हैं कि जब तक वो जानते ही नहीं है ये साइंस के बारे में.
We should quote Herring, no? He was given the job of trying to disprove homeopathy, and he became the greatest homeopath after studying it. So when you study, then you're convinced. So you study it, or tell patient you try it, and if it works, good. If it doesn't work, you give it up. That is one,
But that is what happens, because when I've had patients who come to me, have been suffering for a long time. The doctor, his family doctor said, there is no treatment for you. So he stopped doing everything. and then maybe his neighbor or his job friend, he was cured with homeopathy for the same complaint. So he told this guy that there is treatment for your problem in homeopathy. And so after many years of suffering, he comes to a homeopath and gets cured. So this is where the people should basically know that there is nothing like if there is no treatment in one therapy.
It doesn't necessarily, we are not promising, okay, try it, you won't lose anything. Like, you know, some such very strange examples, like I gave that case, I had a case of a lady recently who came to me back after 20-30 years with severe migraine. The migraine so went, she did a reducing therapy which came hanging skin. And then she was jackets. And we gave her, because of the hanging skin, we gave her staphyagria. And the skin has tightened. Today she spoke to me and said, I can see the effect, even after wearing all that, it was not, but I can see the effect that is tightening. Now here, where is the faith and the placebo effect when the skin tightens up, which has got loose because of loss of weight growth. So yes, we have tried to answer. Do we have Dr. Praveen Shah? Praveen Kumar. Dr. Praveen Kumar, are you there? Who has done so much research on AIDS, which is like mind-boggling. You should share it with us. If someone is taking treatment on the chat, taking treatment for hypertension, and starts homeopathy in addition, will the homeopathic drug have an added effect and reduce the BP to below normal? It can happen. It can happen. So that's why we have to monitor the BP all the time, right? So, and then only we, as Dr. Shobha said earlier, that then only we should start reducing the medicine. So, yeah. So our time is up. We are a little over time. And I think we've had a session.
मैडम, आपका डॉग टेस्टिमोनियल्स देने जा रहा था कि उसको कितना बेनिफिट्स हुआ है होम्योपैथी से, आपने उसको स्टॉप कर दिया.
बस कितना भौंका, वो इतना वीक था, and we gave him, you know, I said, the vet said, please give him a painkiller. I said, no, I'll give him Briania, he'll be better. Is he better? Yes, he's better.
वो वही बोलने जा रहा था.
So thank you very, very much, audience. Thank you for being with us throughout.
The last thing which I would like to say is that homeopathy is based on the nature's law of cure. So the homeopathy healing is always in alignment with the nature. And when any system is in alignment with nature, there is no danger from the outside, whether it is allopathy or whether it is any other pathy or any other pharmaceuticals or anything. So it is going to work wonders, and it is never going to die, and it is going to remain in the world and going to give its best of the effects.
And comparative, very cost effective also.
Dr. Qasim, Dr. Adil, if you're there, please come in, Dr. Qasim. Just bless this thing and tell us how it is. You want to add anything, please come in. He's our most senior,
Yes.
Dr. Qasim, are you there?
I think so they signed off.
Okay.
Okay.
Please discuss for LM potency. Okay. 1 minute we'll take on LM potency, please. Somebody. Okay.
LM potency is given, we select the LM potency whenever, we need to repeat a lot. The way earlier we have discussed that, we are trying to check with the dosages. We are not overdoing the dosages of the centesimal potencies. So, but there are some pathological conditions which needs repeated stimulations. For example, the cancer. Now, cancer is a disease where the multiplication of the cells is very fast. And to, to stop this multiplication, our homeopathic medicinal force also has to be stronger than the disease force. So, to stop that or to help the patients in that, we have to give multiple repeated dosages. That is, I think some doctor is also asking about the water dosages. So in that time, what we can do is we can dissolve this LM potency dosages in the water, and we can give it enough frequent repetitions, and that is how it will not cause the side effects at this or no aggravations. At the same time, it will have a beautiful effects.
So, very good. Dr. Praveen is saying it was very good. Dr. Praveen, we wanted you to quickly tell us about your little AIDS research, which is like you have done it. So it is like authentic research and how it worked well. Dr. Praveen, would you like to come in?
Dr.
Praveen is very
Preeti would need to unmute Dr. Praveen, sir.
So we have to unmute Dr. Praveen. Preeti, are you there?
You want me to call her?
No.
Not able, Dr. Praveen.
Hello.
Not able.
Hello.
Yes, yes, Praveen, we can hear you.
Yes. I heard it through and through. Very good. I enjoyed all the things which we have been facing it. You guys have discussed at length very well. And I felt this is very useful to the neophytes more than the established practitioners.
Yes, they have
It's
to
very
share.
encouraging for them.
Yes.
It will be very useful for them because there will be a lot of questions pondering in their mind as well. They should not start with a negative mind. This session, if they have attended, it would be very useful. And if it is available on YouTube very early, probably it would be very useful for the fraternity, especially for the interns and PGs. It would be useful.
Would you like to share your AIDS research in brief?
Yeah. We have done an in vitro research along with Indian Institute of Chemical Technology, Hyderabad, from 2012 to 2014. At the end of 2014, they have come out with the results stating that Crotalus horridus 30 has the capacity of inhibiting the reverse transcriptase enzyme of HIV virus. Taking that, I have requested the Telangana government. They have given me the permission. I have started a specialty clinic in JSPS Government Homeopathy Medical College, Hyderabad. Since May 2015, because in April, Global Homeopathy Foundation, we have organized one World Homeopathy Summit in Bombay, in which the scientists from IICT and myself, we both announced this scientific result to the public, and then we started the treatment in our OP in the college. And you would be very happy to note that more than 50,000 patients have registered in our JSPs. I have in my personal clinic, I have more than 2,000 HIV/AIDS patients registered with me. They are showing tremendous improvement. They are showing many such miraculous improvements. And now government, when I was about to retire, I have entered into an MOU with CCRH. Now the CCRH is monitoring this HIV clinic in JSPS, and they would come out as early as possible with the astonishing results. It would be very useful for the fraternity. It will be useful for the suffering humanity as well. Thank you.
Thank you,
Very
Dr.
good.
Praveen, and thank you for bringing up
Fantastic.
one point
Very
which
good.
we did not discuss, which is magic. I really want to discuss this for a minute more, since our audience seems to be still very interested. So
This coming
the
directly
word
from
magical. Please, what is the panel's opinion on this?
No, ma'am, this coming directly from Dr. Praveen Kumar, sir, who is the first-hand person who is involved into it and who has done this. This is like icing on the cake. You know, it was the best thing that is his contribution.
A research, yes, project.
Yes.
Okay, word on magic. The word magic, that is used very often for the homeopathic cure. What is your
Miracle, magic, all these words are used.
yes?
Ma'am, that is what is the patient's experience. The patients, when they are experiencing it, the way we said that it acts so beautifully, so quickly, you know. I remember one case of mine, that girl patient, around say 10, 11-year-old girl, she had an acute appendicitis pain. And she was not even able to stand, and like she had almost literally bent down when she was in the clinic. And I sent her for this sonography. when she went from clinic till the sonologist, before that I had popped, meaning given her some medicine, one dose. Till she went there, she straightened up. And the inflammation which was seen over there, the radiologist was surprised. The mother was surprised to see her, how she was in a very bad pain within no time, just that she has gone from one clinic to another and there is a change. So that is how these type of results, the people feel that they are the magical results, which
I know what I want to, Shobha, I understand that. I also say it is like a mother's hand, you get results so softly that you don't realize. So people say, did the medicine really work? Oh, I thought I was just doing something right. So these are some of the questions also which we didn't tackle. But all I want to say at the conclusion is that a word magic somehow brings in esoteric and something else and non-scientificity. So we all should differ from using. We may feel it is magical, and we know patients use it, but we should differ from saying it is magical. We say that is the effect of the homeopathic medicine, which works very rapidly. So the word we should take out from our own dictionary, because it then brings in witchcraft and so many other things which we are blamed for anyway. Okay.
And steroid.
Dr. Kasim says, unmute me. Dr. Kasim, please unmute Dr. Kasim.
From this magic also comes the allegation that we are using steroids.
Again, to that steroid question, I have a very patent answer. मेरा steroid आपके steroid से अच्छा, ज़्यादा अच्छा क्यों है?
Correct.
Steroid cannot help in each and every condition, even when it is given as
So,
per
but
the,
Preeti, just ask
not
Preeti
all
now.
the diseases.
Preeti, please unmute Dr. Kasim. Dr. Kasim.
Yeah, he asked to unmute.
Shobha, you ask him? Ask her?
Hari Om.
मैडम, ये म्यूजिक की बात हुई ना, मैं मेरा केस बताता हूँ।
हाँ जी।
एक लेडी को किडनी स्टोन हुआ था, तो यूरोलॉजिस्ट ने बोला कि इसकी सर्जरी कर देते हैं। लेकिन उस वक्त शी वाज इन मेंस्ट्रुएशन साइकिल, तो डॉक्टर ने बोला 1 हफ्ते के बाद हम सर्जरी करेंगे, अभी नहीं कर सकते हैं। तो उसके पास 1 हफ्ते का टाइम था, उसने होम्योपैथी ट्राई किया, मेरे पास आए और विद इन 4 डेज वो स्टोन निकल गया।
Anecdotal.
No doubt allopaths blame us and they speak against us.
Yeah. अब मेरा पेशेंट कहाँ गया? सर्जरी टेबल तैयार है, पेशेंट नहीं है।
Yeah. And the steroid thing, I have a patient who is 2 years old and has alopecia totalis. In 4 months' time, she started developing hairs and got hairs all over her scalp. So when the family went to the family doctor said, be careful, don't give too much of steroids to this patient.
Why didn't you give steroid? Yeah. Dr. Kasim, क्या हुआ? प्रीति में
Hello.
Yeah.
Hello,
Yeah,
Dr. Kasim.
Dr. Kasim is here.
Dr. Kasim, good evening. We are so happy
Good
to have
evening.
you.
Hello, sir. Good
After
evening.
hearing you,
Hi, this is Dr. Adil also here. I'm beside
Hello,
him.
Adil.
Hi, Adil.
after hearing you, I remember today morning incident which I like to share with you.
Yeah.
I have a patient who are both are MDs medicine practicing, and their child unfortunately had autism. And their question was that he asked me, sir, shall I ask you one question? I said, ask. Sir, how does homeopathic medicine act? I said, forget about it. By that time, the child was playing, and even the mother, she was asking the child not to do this, and the child listened. That means the child was able to hear, the child was able to
Wonderful.
respond.
Wow.
I said, forget about where does it act and how does it act. You simply see, does it act or not? Believe me, Vishpala, she wept so much. She said, sir, how can I thank you? I don't understand. My child has started playing with me. Today I am able
Wonderful.
to converse with him. So
Wow.
she was so emotionally upset that she said, as I asked her whether he's able to listen, he said, yes, probably he's able to listen my lip reading, he is able to listen my behavioral pattern, and he is able to respond. So there was a fantastic reaction in an autism child. And I told them, forget about where does it act and how does it act. You simply see whether homeopathic medicine act or not. If you are
Correct.
convinced, then start sending patients of autism to homeopathy. So this is the only thing which I can tell you.
Yeah.
Good,
And
good.
please
Very
forget
excellent.
asking all these questions.
Even
Today,
Dr. Hanneman has said the same. Do not
Ye-
waste time by telling how the medicines act, judge it by the results.
correct, only the results will speak.
Yeah.
Right, sir. Right, sir.
Thank you so much, Dr. Kasim. Please
Thank you very
come
much.
every
And
time. Thank
I'm
you.
Adil. So last week we had an All India Homeopathic Research Summit in Nagpur. About
Yeah.
4,000 people attended here.
Mm.
And lovely research papers. We had 15 speakers and all research-based speakers. Very, very good research in various topics on hepatitis, then cardiology I presented, hypertension, and so on and so forth, and different approaches. So it's
Quote,
way
can
beyond
you
now.
quote, Dr. Adil, can you quote one of them? And Dr. Kasim is the honorary advisor of NJH. Adil is a member of NJH. So people don't think that we are just calling anybody random. We are all very, now we are, our total of 170 has now gone to some 250 years.
Of course, I
Yes,
will
yes,
try
yes.
and I will
Very
try
true.
and see that I will send you something substantial for our publication.
Wonderful.
Thank you very much.
And
Okay.
Adil, can you tell me
Fantastic session.
about
And
the cardiology?
And we want to see you, Kasim Bhai and Adil. So just drop for a post meet now. We'll send
Yes.
you a link. Okay.
Oh, yes.
Okay.
Thank you.
Hello,
And
Bankar.
great audience. Very nice audience to stay all
Yes,
this
sir.
way. We are half an hour over time. And thank you very much. Thank you. Thank you,
My pleasure.
panelists. We had a wonderful time.
Thank you, Jagose.
Rocking session.
Thank you, sir.
Shemna,
Thank you, everybody.
Thank you, everyone.
Akshay,
Yes, sir.
Varna,
Thank you very much.
good. Thank you so much.
Thank you.
Thank you, sir.
Ketan,
Thank you, sir.
that's all right. Chalo.